I'm Julie Bartke with Session Update. Legalizing medical marijuana took a step forward in the Minnesota Senate on Friday, with the Senate Health, Human Services, and Housing Committee passing the bill. The debate centered on an amendment offered by Senator Julie Rosen, which would delay implementing the legalization of the drug until more information is available through studies.
The notion that Minnesota's going to be able to implement a study looking at high CBD is probably years away. And in the meantime, these folks, all the good people here who've traveled from all over the state to impress upon you the desperate need that they have to be able to, to have safe legal access to whole plant medicine. These people will continue to suffer every day because we're going to delay a medical marijuana bill in order to implement a study. I think that's deeply concerning.
This is something that is, I think, a good compromise to a bill that we would like to see move forward as far as relief for some of these patients that are suffering. But I think there are a lot of unanswered questions about medical marijuana. I believe the governor has expressed his concerns about that, and he proposed a study. Unfortunately, I think the study language had $2.4 million in it for grants, which are not feasible at this time. But I believe, as you can see in this amendment, you're dealing with a Schedule I drug, number one, that does need to go through FDA approval, and they are working on that. And I know that any drug that goes through the FDA, I'm sure it's at least a dozen years of trials, but I could be wrong on that, and I would ask Dr. Sisley. But as you can see, it's going to give us some of the answers that I think we need to have in order to move forward.
I think we do have a lot of experience now that we can draw from other states, showing and learning from them what works well and what doesn't. And I think if we were to pass this proposal, it would become, I think, the model, the gold standard for the rest of the country. It's not quite the Wild West. That would be an overstatement. There is a lot of data and a lot of knowledge that's being passed back and forth between practitioners and researchers and the like.
One of the things that I wanted to emphasize today is it is possible to conduct active clinical trials in the midst of having a very robust and conservative medical marijuana program in your state. And I think that would be the optimal choice for this state, is to approve this bill as is, as amended today, and enable these clinical trials to occur hand in hand with a very strict program.
When I look at like the blind studies and the studies of science, well, like the most recent one that came out from Boston, they're showing changes in the brain with just minor use, and that it affects the areas of the brain that affect decision making, emotions, and the ability to become addicted to other substances.
This piece of legislation before us today is well intended. There is a specific problem that it is trying to address, but it's premature. We do not know what would be effective. We don't even know what a consistent dose is.
We're saying around this table that we need more research to be able to make sure that we know that we're moving forward in a responsible way. And I think the amendment that is before you, the A4, is going to give us those results. And so to go ahead and move with the bill and then get the research later seems to be a little irresponsible.
I think we should keep going ahead. I think it's going to be a very long process for the current bill to take effect anyway. So my only point is that I think the study in here it's right, we should be doing a study. I'm not sure this is the right one, and I don't think that's a good excuse for delaying the bill.
I think some elements of the study are good and will help inform and support the rule writing that does need to occur over the course of the next year and a half. And like I said, no one is going to be being issued cards until next year anyways. And rule writing doesn't occur under deep cover either. That is a public collaborative process. with stakeholder participation and hearings and all of the like.
The amendment was incorporated into the bill, not as a replacement. Now, if you wish to view the entire committee and any activity at the Senate, just follow us online and on our YouTube, Facebook, and Twitter accounts.